From a PACT perspective, we think about entrepreneurship on a daily basis and expanding that in this region. Just this morning, I was on the phone talking about tax credits. So because I've talked about it before, that about a year ago, we worked very closely with Ben Franklin to launch Innovate PA, and that is now on its way. And money should start flowing from Innovate PA, which is a $100 million tax credit program, at some point next year in 2015, and find its way very quickly into the hands of an increasing number of early stage entrepreneurs. Also, it's interesting you talk about companies versus places. Just in the past 6 months, and again in another month from now, we've actually taken bus trips. We took a bus trip up to New York with a bus full of entrepreneurs to introduce them to early stage VCs, and we're going to do the same thing with a bus load down to DC. So I really love some of the ideas that were shared around the panel, one of which was focus on your strengths. And for the next 10 minutes or so, maybe 7 or 8, we're going to share with you one of those strengths, and it is digital health. We talked about life sciences. The intersection of life sciences and technology is digital health. Last year, you probably remember PACT, Ben Franklin, and EY debuted the Philadelphia Investment Trends Report right here, demonstrating the growth in venture investment activity over the past 5 years. This year, we have focused on one of, if not the hottest subsectors in the region, digital health. We also added a few collaborators in the process to help form this project. And right now, I'd like to ask to join on the stage the groups that participated in this. First of all, Amy Dorfmeister is a partner with EY. Claire Greenwood, Executive Director of the CEO Council for Growth. And Alan Bourne, the Director of Fairmount Partners, and also the chair of our forum conference. Finally, I'd like to invite Roseanne Rosenthal on stage. Roseanne is going to provide an overview of the report, which copies are available right outside those doors in just a few minutes. And I'm going to ask Roseanne to share a little bit, just a couple slides on the report.
Thank you, Dean. And good afternoon, everyone. Welcome to Impact 2014, and what a terrific weather we have outside. Rivals California anytime, right? So as Dean mentioned, for the second year, PACT, EY, and Ben Franklin have teamed up to provide information on the region's investment activity. And here we go. Let me just see if we can get this going. There we are. Good. Last year's report, Venture Impact, profiled the trends and highlighted technology investment across the greater Philadelphia region. And as Dean mentioned, this year, we're zeroing in on the growth area of digital health. And we welcomed Fairmount Partners and the CEO Council for Growth as our new partners here. So to paraphrase a favorite expression that Dean uses, the purpose of this report is to hang a lantern on the region's digital health strengths. The report does not compare us with other communities, but it tries to tell us where we are today. It's just a starting point. It's always a challenge with a new technology and when a new sector emerges to develop a consensus on what is in and what is out, sort of like Heidi Klum's phrase, right? For purposes of this report, we're focusing on 3 digital health subsectors: enterprise healthcare IT, consumer or mobile healthcare IT, and medical robotics and electronic medical devices. The report covers a period of 6.5 years from January 2008 through June of this year. It looks at activity across a 12-county footprint in Southeastern PA, New Jersey, and Delaware, and it draws from various proprietary databases. So the conclusion is that healthcare is a growing regional sector here, healthcare IT. Since 2008, over 100 companies were formed, and they've gone on to raise over $900 million in financing. So this slide gives you a snapshot of the total number of digital health companies since 2008. What it doesn't convey is the trend, and that trend shows a steady increase in both the number of companies formed and funded. This slide really brings home how the sector is built upon the region's significant healthcare and pharma assets. 2/3 of the companies are developing solutions for providers and payers. Of those, 35% are enterprise management software firms, and 58% are involved in care coordination, information exchange, diagnostics, and big data analysis. 54% are targeting hospital systems. The pharma 21% is largely supporting clinical trials and raised the most outside funding. Newest to emerge in the trends are the solutions targeted to patients directly. That's the 16%. Here we see the diversity of the companies in the region and the level of funding that they've attracted. 4 of those categories are connected with the pharma and clinical trials area. And in the others, we see the impact of the Affordable Care Act in terms of demand for data, the need to improve operating efficiencies and achieve cost containment, focus on outcomes, and the need for communication and information exchange. So where are they located? Here we see the map of these companies with the greatest concentration being in Philadelphia. Others are located in and around the region where large pharma and healthcare companies are or were located. And we're very happy to say that 34% of the companies were seeded either by Ben Franklin or Dream It, and that reinforces the need for pre-seed and seed capital financing that was identified in the last report and even mentioned in the last panel. So where do we go next? We're happy to say that digital health is being recognized as an important driver for regional growth by policymakers. The report lists activities already underway in organizations that are creating a receptive and a supportive environment for enterprise formation and investment, and more is going to be coming in the way of coordinated effort that's on the drawing board. So with anything, it takes a lot of competent staff and dedicated people to get a job done, and in this case, for this report, I want to thank the staff members of PACT, EY, Fairmount Partners, the CEO Council, Ben Franklin, our consultant, Harbaugh Strategy Group, and Merit Corporation, who contributed the printing of this report. Copies are outside, and you can also read it on the websites you see there. Thank you.
Thank you, Roseanne, and to all of our collaborators. You know, I can tell you that that number, the 900 million, is way underestimated. It is only from reported transactions, and I know of 2 transactions that would double the size of that. So there is a lot of activity in the digital health region, and certainly much more expected to come. All right, it is time. There are some people that have already jumped the gun, have gotten to the break. It is time for a break. You need to be back here by 3:40, so we're going to give you a full 25 minutes plus, and we'll come back to hear our top technology buyers panel, as well as our opening keynote, Bill McDermott, the CEO of SAP. Today's networking breaks are sponsored by Blank Rome. Thank you.